Good evening, students. Here again, we are back from the chapter number 4, reproductive health. So, reproductive health is actually started from the first part. The first part is the what is a reproductive health? Actually, it is the total physical, emotional, behavioral, and social level. So, the total, if any type of the person which is social, behavioral, emotional, and physically in touch, in the reproductive health is also good. uh, Students, previously what I sent you the videos. In that case, I already sent the PDF of that one, so don't worry about it. These videos really useful for you at the last moment, and also it creates a big revised pattern. So the second thing is problem and strategies. What are the problem and strategies coming during the time of the reproductive health? So at the starting in 1951, family planning program is started in 1951 in India, and the strategies are reproductive and child health care. By the help of the audio, visual, and media, we are planning to aware the people about these things, about the sanitary copulation practices, about the birth control, postnatal care, how the mother should be cared before the birth of a baby. Uncontrolled population awareness also must be there. Sex education is a very important part. So, what are the problems which occurs in during the population explosion? So, first problem is unemployment. As you see, because of the unemployment, the peoples are using many things, and these unemployment, they don't have any work and do different type of the bad task. The second one is poverty. Because of this poverty, most of the peoples are going to do that work which is not good for the country. The third one is the high childbirth rate. Means if you say 8 days happening on 1st December and second population days happening on 11th July. So high childbirth rate means the birth rate of a child is very high. Crime rate is increased. Social fabrics are disturbed. Resources burden is also there. Deforestation is happening, and pollution is creating. So these are the population of a population explosion problems. What are the reason of population explosion? The reason is actually developing health. These are the reason. Because of developing health, developed technology, the lifestyle should be superior. Mortality rate is decreases. Maternal mortality rate, birth rate is decreases. Infant birth rate is infant death rate is decreases, and the reproductive age is very less. These are the some type of the reason why the population explosion is there. If you go for the steps of birth control, the first thing, there should be a legal age. A male should be 21 years and female should be 18 years. I think so. Nowadays, the age should be increased of the female also. Use of the contraceptive methods, and couples with a small family must be featured. So, what are the feature of ideal contraceptive? Mostly question arises from this part. The ideal contraceptive has some characteristic. It should be easily available. It should be user friendly, maybe reversible, there will be no side effect. If it is cost effective and also effective also, there should be no interference in sexual desire. So, because of this, many contraceptive methods are there. These numbers will show that how many parts of these things. So, first thing is natural method. Second is a barrier method. Naturally, it is occurs in barrier method by the help of the barrier. Intrauterine devices, which are used inside, injected inside. Oral contraceptive like a pills, injectable and implant like injection, and surgical method by operation. So contraceptive methods are different. If we go for the natural methods, the first one is periodic abstinence. Periodic abstinence means if we go for the natural method has a three parts: periodic abstinence, withdrawal or cortex interrupt, and lactational embryo. So periodic abstinence means avoid the meeting in the first 10 to 17 days, depend on the male. Withdrawal coitus. You have to withdraw the copulation to remove the penis from the vagina before the ejaculation. And the third thing is lactational amenorrhea. Lactational means during the time of the milk feeding, there should be no menstruation, so no effect of fertilization. Next one is the barrier methods. Condoms you are using, it is a thin rubber sheath used by males and females. Second one is diaphragms. It is type as a walls, cervical caps made up of rubbers and can be reusable. And the third one is spermicidal cream, which is used to increase the contraceptive efficiency so that the male or the sperm and the ovum is not going to fuse or somehow they have some effect. What are the IUDs? IUDs are very effective. First one is non-mediated, like as a lipase loop, because lipase loop prevent the fertilization by increasing the process of sperm phagocytosis. Sperm phagocytosis means the cells of a sperm is going to be blast out. Now the copper releasing, it is CUT and CU7, maybe multiload 375. Mostly asking what are the copper mediated intrauterine devices because it reduces the mortality rate or mortality and fertility also. If we go for the hormonal releasing, progesterone and LNG20 make the uterus unsuitable for implantation. It means delay in pregnancy. Now the next one is oral contraceptive. As you see, steroidal pills and non-steroidal pills. It is divided in two parts: steroidal pills and non-steroidal pills. Why? Because steroidal pill is of two types. One is progesterone pills, another is progesterone estrogen pills. Combination of these two. So progesterone pills stop the menstrual cycle, and progesterone estrogen pills prevent the pregnancy by stopping the ovulation also. If we go for the non-steroidal pill, it can be taken by any of the government hospital. Such is a type of the pills are present there because it can be taken for 21 days if you want to stop your menstrual cycle. And if you again want to start the menstrual cycle, then you have to leave these pills for the 7 days and your MC will start. Now the next one is injectable implant. There is some type of difference. Actually, it is a combination of progesterone and estrogen, but if we go for the implant, the nexoplanon, a type of a flexible plastic which is placed in the skin of arm by doctor or nurse, and it release the progesterone into the bloodstream to stop the pregnancy for the 3 years. If we go for this one is implant and injectable by the help of the injection. The surgical method is two, very important: vasectomy and tubectomy. Vasectomy is actually vas difference of a male is cut and bind. And if we go for the tubectomy, it is in female, fallopian tube is cut and bind. So these are the methods of contraceptive methods. Now if we go for MTP, the next part is MTP, medical termination of pregnancy. Medical techniques of terminating the pregnancy. So the first one is if the mother, why this can be happen. If the mother is in danger from the fetus, and it is safe during the first trimester only. 12 weeks after that takes risk. And pregnancy caused by the rape. But sometimes the rape is happen and due to that the pregnancy is going to be occurs. Now we've got for the STDs, sexually transmitting diseases. There are three parts. What are the diseases? What are the modes and how to prevent? The disease is number one, gonorrhea. It is happened by bacteria, and because of that painful urination is happening. Second one, syphilis, a bacteria which create a itching or pain. The third one is chlamydosis. It is a type of bacteria which gives the painful intercourse. The genital warts is a virus done by the virus warts over the genital part. A small type of a you can say pox is happening. Trichomoniasis, and by the protozoa, the glands is going to be swell. AIDS, you already know your famous HIV virus, and it weaken the immunity. The next one is genital herpes, done by the virus. The red is ulcer over genital organ is happening. And the last one is hepatitis B. As you see, the vaccine is also available, done by the virus. Rash and abdominal pain is there. Now, what the modes are there? Modes are the sexual transfer, firstly. Second, skin to skin. Number third, infectious blood. Number four, needle sharing. Number fifth, mother to fetus. And number six, if you share the bedding and clothes. How to prevent it? Avoid sharing, take a vaccine, don't use drugs, and don't use multiple partners. This is the only safest thing. Now, what is infertility? Actually, infertility is of two types. Number one is primary, number second is secondary. If we go for the primary, they never had conceived any children in his life or her life. But in secondary, have one children but not conceive the other. Two type of infertility. Cause in male, the cause is low sperm count, low sperm quality, absence of sperm, or sexual dysfunction. If we go for the female, some type of the ovarian syndrome is there. Maybe age related factor, menstrual cycle is not properly working, uterus problem, and fallopian tube is damaged. Last part is ART, assisted reproductive technology. Actually, it is of six types: IVF, ZIFT or AUT, third one in vivo, fourth is GIFT, next one is ICSI, and number sixth is AIR, artificial insemination. So in IVF, ovum and sperm fuse outside in lab. It is a type of a technique which is also called as a test tube baby technique. Happened in many of the hospitals, like if you can say, many type of the hospitals in Lucknow and Kanpur, even they are using IVF technology. Now the next one is ZIFT. ZIFT, zygote infertility transfer, or IUT, intrauterine transfer. The 8-celled blastomere transfer to the fallopian tube is called as a ZIFT. And if 8-celled stage is placed directly to uterus, then it is called IUT. If you go for in vivo techniques, the gametes are taken within the female body. Gametes are taken and done the mixture of zygote formation inside the body of a female. If we go for the GIFT, gamete in fallopian transfer, the ovum is going to be transferred to another female body, just a life of a surrogacy. Go for the ICSI. Go for the ICSI. In ICSI, sperm is injected through microinjection. By the help of the micro injection, sperm is injected. And the last one is AI, artificial insemination. The semen is collected from the husband also, and also from any type of the donor, and transfers to the vaginal of female. So maybe during these type of the techniques, ART technique, assisted reproductive technology, nowadays it can be possible to conceive a baby. Now there are some PYQ most important question. Number one question: what is the reason why breastfeeding of the baby act as a natural contraceptive for the mother? Number second, our government has an internationally imposed strict condition for MTP in our country. Give a reason to justify this. Now the third one is एक IUD. Name the IUD that would recommended to promote the cervix hostility to the sperm. cervix में यूज़ किया जाता है ताकि sperm उसके अंदर hostile ना हो सके. Now, what is amniocentesis and how it is misused? Amniocentesis is the use of, by the use of amniotic fluid, we can detect it out that the male baby is forming or the female baby, the gender of a baby or fetus. Now, list any four characteristic of an ideal contraceptive, as you already know, already written. Why is Saheli considered as an effective contraceptive for women? Give any two reasons. And why the ZIFT is a boom of the childless couple, and explain the procedure of the ZIFT. The last one is why do oral pills contain and how do they act as an effective contraceptive. Somehow vasectomy and tubectomy is very important, and somehow copper releasing IUDs is also very important. So you have to go through each and every part and must learn this part is very important. Each and every part is very important. So I'll send the PDF after 1 days or 2 days, or maybe I will not post also. Both thing can be happens. But Before that, you have to go through the video and understood the video fully and sharply. It is just only the 16 minutes video. So have a nice day, and like, share, and subscribe, and also share to some, and also find out the notes also there. Maybe some questions of the PYQ is very important. Definitely. Each and everything is going to be in the description mode also, and if any type of the comment is going to be happen there, then you have to comment it on basis of the behalf of this. You can ask the question anyhow. So don't worry about, your paper is going to be good, and it is not a problematic situation that your paper is not going to be good. So go through the each and everything, and every part is featuredly separately written here, and write we make one question and write out the answer. So thank you, have a nice day, meet you in the next video. Thank you.